Bismillahirrahmanirrahim. Assalamu alaikum. The topic which we are going to do today is our developmental disturbances of the oral region. We'll start with the first uh, subtopic, which is the developmental disturbances affecting teeth, because developmental disturbances of oral religion are discussed under three broad categories, that is, developmental disturbances affecting teeth, developmental disturbances limited to soft tissue, and the developmental disturbances affecting bone. Now, the developmental disturbances affecting teeth are further divided into some subcategories. The first category is disturbance in size. Now, in size, there are two types of disturbances. Either the size is small, microdontia, or the small size is large, that is macrodontia. First, we'll see microdontia. Microdontia is when one or more teeth are smaller in size than normal. When all the teeth in the both arches are smaller than normal, the condition is termed as generalized microdontia. If all the teeth are uniformly smaller than normal, as in all the teeth are smaller, then this is called true generalized microdontia. It occurs in uncommon conditions such as pituitary dwarfism. The term relative generalized microdontia is used when the mandible and maxilla are somewhat larger than normal, but the teeth are of normal size. Because the mandible and maxilla are larger than normal, they give the appearance or illusion that there is microdontia. This is known as relative general microdontia. In this type of microdontia, the teeth are spaced, and the microdontia involving one or more teeth is known as localized microdontia. It is more common than the generalized microdontia. Okay, then the teeth which are mostly affected by the localized microdontia are maxillary lateral incisors, which are known as peg laterals, and the maxillary third molars. In addition to being small like miniature teeth, their crowns often exhibit a conical shape. However, maxillary and mandibular second premolars, which are often congenitally absent, rarely exhibit microdontia. Supernumerary teeth are commonly smaller than normal, always, and their crowns are also often conical. This is peg lateral microdontia localized. This is the picture of generalized microdontia. Now let's come to macrodontia. Macrodontia is when one or more teeth that are larger than normal. The conditions, when all the teeth in both arches are measurably larger than normal, then the condition is called true generalized macrodontia. It is seen in rare conditions such as pituitary gigantism. Now, what is termed relative generalized microdontia? It is used to describe a condition in which the mandible and the maxilla, or both, are somewhat smaller than normal, but the teeth are normal in size. Okay? They are smaller than normal. So, this gives the appearance or illusion that it is macrodontia. Okay? Now, the clinical features is that the crowding of teeth we can see, and regional or localized microdontia is occasionally seen on the affected side of the mouth in patients with hemifacial hypertrophy and in segmental odontomaxillary dysplasia. Macrodontia of individual tooth is occasionally seen, but it is rare, and it should not be confused with the fusion of two adjacent teeth. Macrodontia is rare, fusion of two adjacent teeth is more common. So they both should not be confused. Now, what is rhizomegaly? Rhizomegaly, which is also termed as radiculomegaly, it is an uncommon type of macrodontia in which roots or root of a tooth or roots of a tooth are considerably longer than normal. This condition is most commonly seen in the roots of mandibular cuspid teeth. There you can see macrodontia. That was all for disturbances in size of the teeth, microdontia and macrodontia. Thank you very much.